Transgingival electronic nerve stimulation with Skorpion dental Optima. The movie is made under the methodological guidance of Assistant Professor Dr. Stoyan Vladimirov, Director of Endodontics and Operative Dentistry Department, Faculty of Dentistry, Plovdiv. Contemporary anesthetic medicines ensure to a great extent the comfort of the treatment in the dental surgery, but there are specific at-risky patients. With them, the local and conducted anesthesia is not reliable. Such patients are patients with injection fear and unpleasant tingle after anesthesia, with anesthetic allergies, diabetics, or patients with pulp thermal and mechanical sensitivity. In all these cases, the using of TENS is recommended. Transgingival electronic nerve stimulation is an electronic method. Series bipolar needle-like impulses with different shape are used. They are amplitude and frequency modulated for avoiding the adaptation. The portal control theory of Melzack and Woe is used in this method. Impulses for pressure and vibration coming from A-beta nerves are constantly and dynamically interacting in substantia gelatinosa with pain impulses from A-delta and C nerves. Transgingival electronic nerve stimulation impulses are conducted faster by the A-beta nerves and activate the intermediate inhibitory neurons. The portal shuts down and the impulses for specific and diffusion pain through A-delta and C nerves cannot reach the central nervous system. Nucleus caudalis and formation reticularis are portals in the system of trigeminous system. Transgingival electronic nerve stimulation blocks the caused by operative procedures pain which comes along the afferent nerves. At the same time, the endogenetic analgesic system is activated and produces endorphins. Transgingival electronic nerve stimulation is not recommended for patients with pacemaker, insult, epilepsy, mental handicap, fear of electricity, uncertain oral cavity diseases. The method is recommended for caries treatment, preparation of hard dental tissues, and prosthetics. The advantages of the transgingival electronic nerve stimulations are pain elimination or oppression without injections. The patient assists in the procedure and this involves his motor and mental reactions. The normal sensitivity recovers very fast after the end of analgesia. Presence of torque assistant which helps in registration of the patient's reaction to the certain pain level so the dentist is able to dose working time duration. Transgingival electronic nerve stimulation will be applied to a woman patient with caries. It is explained to her what this kind of anesthesia is, what she will feel during this procedure, how to supervise the sensation of shiver with remote controller. The procedure starts with switching a clip-type passive electrode to her right hand. Lint moistened with physiological solution is placed between the wrist of the patient and the metal electrode. The remote controller is given to the patient. The active electrode is a gold-plated spring with an elastic ring. The complex includes several electrodes with different diameters. The size of the used electrode depends on the size of the mouth. The electrode should be sterile. The middle of the spring must be located over the treated tooth and the rest of it to cover the neighboring teeth. The frenulum should not be pressed, so an 8-like curve is made and the ring is located between teeth, vestibulum and the cheeks. The spring is placed with forceps over the apex of the treated tooth. Correct location of the active electrode. Spring cable is switched to the red clip. Analgesia starts by pressing the start button. Patient keeps his sensation of shiver above the limit of sensitivity and under the limit of palatability through increasing and decreasing amplitude. This is the optimal painless zone for repressing the pain. Preparation continues till the tingling of the patient, which resembles the sensation as in a case of conducted anesthesia. The filing starts from an absolutely painless area. Received vibrations shut down nucleus caudalis portal, and this stops pain impulse conduction. During the period of work, slight pain can be felt. The patient changes impulse amplitude. Voice assistant registers and informs for this correction, so the dentist has reverse information for the pain level and can change the working time rhythm. Together with the conductive and local anesthesia, transgingival electronic nerve stimulation is a preferable method for anesthesia in contemporary stomatology because of the following reasons. Includes patients not liable to another type of anesthesia. There isn't injection fear or discomfort. Patient takes an active part in pain elimination. Voice messages give the dentist information for dull pain level. The normal sensitivity recovers very fast after the end of transgingival electronic nerve stimulation, analgesia.